As the finance minister is preparing to deliver his budget speech, one organisation is adamant that a 20% sugar tax increase will curtail the prevalence of non-communicable diseases in the country. HEALA has written to Treasury officials regarding this, saying it will also increase the fiscus. Petronell Kruger, HEALA Programme Director, joins us live now to discuss this further. Good evening to you, Petronell, and thank you so much for your time. You say that VAT is not the solution and a 20% sugar tax might help. Tell us why.
Absolutely. Thank you so much for having me. Yes, I mean, it's no secret that increasing VAT is really just taxing the poor in South Africa. And that really has implications that will impact even middle and high income households, because that's going to determine how much money is available in the economy. Now, one area that is sorely neglected when we do South African budgets are excise taxation, which is sometimes called the reason we tax certain harmful goods are because those goods cost us money. So a very easy parallel is to say that when, alcohol causes drinking and driving, and that means there's going to be an increase in public infrastructure expenditure because drunk drivers will drive into traffic lights. And sugar taxation works on effectively the same principle. So when people are ingesting more sugar, they are becoming iller, and that really costs a lot for especially the public healthcare sector. So at this stage, we're calculating that diabetes costs the public healthcare sector about 2.7 billion rands each year. That is a lot of money.
And it certainly is, as you say, quite a lot of money. I mean, 2.7 billion rands on just that alone. One then, of course, would think of other, areas that they would also then be facing, especially when it comes to increasing their spending and increasing their programs on various other programs when it comes to raising awareness of illnesses.
I'm so sorry, there's a little bit of a delay here. So if you don't mind repeating that.
I was saying that you say 2.7 billion rands. That's a staggering amount, especially when you think about the fact that this is a healthcare system that will not only need to focus on this one type of illness, but will have other programs that it needs to put in place in order to raise awareness on the multiple areas of in fact, community involvement, as well as illnesses on a number of those it represents.
I mean, absolutely. And just, we've isolated diabetes when it comes to this discussion, but something like excessive sugar consumption really has a knock-on effect on a range of other diseases. So, you're talking about other healthcare expenditures, but reducing sugar consumption means we're going to have reduced rates of cancer. We're going to have lower rates of overweight and obesity. That's less heart diseases, less strokes. And a study by the University of Witwatersrand has indicated that actually the impact of just overweight and obesity, for example, is 33 billion a year, which is 15% of the healthcare budget. So we have to start asking ourselves, when are we going to tax this and raise money from it?
It may not be received well, though, by businesses in the sector. It's not received well by groups that claim to represent small cane growers, but we've seen local evidence that indicates that, in fact, the effect on local jobs will be very minimal. And the thing we need to understand is that if consumers spend less money on good A, they're going to spend more money on good B. So if we're spending less, for example, on sodas, we're going to be spending more money on other things that South Africans dearly need. And that won't necessarily be beverages, but very likely be food products. And we were seeing, our local agriculture industry really struggling, especially to compete with international prices. So the likelihood and the evidence suggests that money really is just going to be allocated and create jobs in other sectors. So that's just something we need to consider. Who is opposing the tax? Oftentimes it's the same people who tend to profit from the tax. And that's something that South Africans should think about in terms of things like what happened with tobacco. We saw this sort of same pushback where there was a claim that it caused job losses. But the reality is it was just to protect the profits of a few small big corporations. You've written to Treasury to call for this. Have you heard back from them? We have not. So Treasury has indicated that they deem themselves to be within a locked period, so they're not engaging, according to their spokesperson, with civil societies or other interest groups, which is very worrying. I mean, South Africa is a democracy and the principles of public participation is very important. So Treasury being available to discuss these important issues at this time really is something that we would think is a key sort of democratic principle. We're hoping there's a lot of other interest groups talking out about how we should think about raising revenue instead of that. And really one of the key things that's emerging from every sort of corner here is that we need to increase excise taxation. So sugar tax, alcohol and tobacco. And we're hoping that Treasury listens to the public. We're not too hopeful in the sense that we had Minister Gorongwana indicate on that sort of awkward moment where he thought he was off mic that he's not too concerned with what others say. But we hope that the public outcry against that very undemocratic mindset will cause him and his office to reconsider and really think about what the South African public needs.
So let's say, because now you say, of course, they have been saying that they're in this locked period now, but would you then post this locked period then be making some possible, attempts to be able to maybe sit down and actually explain your side, as well as the side of those who are in the beverages space, for example, who say that they're worried about job losses, especially in a country like ours where we cannot afford to lose more jobs. And maybe then all of you at the table probably find a middle ground here?
Well, the Healthy Living Alliance, as well as other groups called, for example, the Budget Justice Coalition, very faithfully make submissions each year and each midterm budget speech on these issues, where we present documents that's backed by evidence to Treasury to indicate why we have these specific asks. We're always available in all of those sessions, and we've had multiple calls to Treasury to ask them why they don't give us substantiated feedback, why they don't incorporate our calls. So during the portfolio committee meetings, there's actually been feedback from the chairperson to ask Treasury to in fact engage more proactively with civil society, and we have not seen that happening. So it's not that civil society is not coming to the table. We're always coming to the table exhaustively. So it's that we're not seeing good faith engagement with civil society.
Petronell, thank you so much for your time. Let's see then what the minister says.